Okay, so for today's session, we are looking at abdominal examination. So for abdominal examination, we'll start with the abdominal examination of the pregnant woman. Then I'm sure next time, if you join this session, we may look at abdominal examination of just an adult, where we use the 4 principles: inspection, auscultation, palpation, as well as the percussion. But for today's session, we'll just focus on abdominal examination of a pregnant woman. So your station is going to have a fetoscope, which is this one, and it is also going to have a tape measure. So when you're examining a pregnant woman, basically you're checking for 2 major things, which is the inspection as well as the palpation. So once you read the scenario may tell you to say Mrs. X has been brought to your examination room and the gestational age is 28 weeks. As the physician on duty, you have been tasked to perform abdominal examination to monitor the progress of the pregnancy. So from there, you're going to sanitize. After you sanitize, you come to the patient and get permission. You're going to say, "Good evening, Mrs. X. I'm student number 812. I've been assigned to perform abdominal examination so that we can monitor the progress of your pregnancy. Can I go ahead? Anything I can do for you around here if I proceed? Thank you. I'll be back to do the procedure." You sanitize. After sanitizing, you don't don in gloves, not even examination gloves, for examination of the pregnant woman only. So the reason is because you're using your hands to feel nicely and touch the patient. That's why you don't don in gloves. So from there, when you come back to the client, you're going to say, "Mrs. X, I'll kindly..." So for OSCE, you're imagining this because you may already find the dummy is already undressed in that manner on your station. So these steps here, you imagine as though the patient is still, or the client rather, is still seated, and then you are telling them to lay on the examination table. So you say, "Mrs. X, I'll kindly ask you to remove clothes all the way up to your waist, and then you lie on this examination table." Okay, thank you so much. Then from there, you are going to start with the inspection. You're going to say, "On inspection, I can see the presence of the linea nigra." And the linea nigra is the black line that develops from the symphysis region all the way coming to the umbilicus when someone is pregnant, and this is normal. Then apart from the linea nigra, you're going to say, "I can also see presence of the stria gravidarum, and this is normal." So the stria gravidarum, these are the stretch marks which develop when someone is pregnant because of the stretching of the tummy. It stretches the skin muscles and the skin breaks, and then you're able to see those stretch marks which are termed as the stria gravidarum. Then apart from that, you can see on inspection, I can also see presence, I cannot see any presence of cesarean section marks or any previous C-section or any other scar. Apart from that, you're going to say the shape of the pregnancy is oval, and this is the normal. So from there, it means now you are done with inspection. You move on to palpation. So you're going to say, "I'm now moving on to palpation," and you're going to show that you are warming your hands in this manner. The reason is because you don't touch a pregnant woman with cold hands. This is going to initiate contractions and the baby may come out prematurely. That's why you show that you are warming the hands. So after warming the hands, you are going to palpate on the symphysis region, pushing it upwards, and then your less dominant hand will be palpating on the fundal height until you feel for some resistance, meaning that is where the uterine wall is starting from. So when you feel the resistance on the other side, you are going to let go on the symphysis region and continue holding this side and pick the tape measure. So you start by measuring the height of fundus. So you place the tape measure from there and measure all the way to where the symphysis pubic bone, you're able to feel it. And then you're going to say, okay, the height of fundus is 27 centimeters, and it is corresponding to the gestational age. So if the gestational age is 28 weeks, you also expect to get 28 centimeters plus 1 or minus 1 to the gestational age. So the two should not be different, but the two should be the same. So after you measure for the height of fundus, you are now going to move to the side and start palpating so that you feel for the number of fetuses as well as their position or lie. So you start with the furthest side, you press in on the closest side and start palpating from the top going down. So if the back is on this side of the dummy, you are going to say on the left side of the the left side of the abdomen, it feels smooth and hard, and this may indicate that this is where the the back is. Then you are going to press this side and palpate the closest side. If this side where I am, this is where the limbs are. As you palpate, you are going to say on the right side of the abdomen, it feels bumpy but hard, and this may indicate that this is where the limbs are. So you now need to feel for the buttock. So you are going to press this side and palpate on the fundal height or fundal region. If this is where the buttocks are, you are going to say, on the fundal region, I can feel for the smooth muscle, smooth tissue which is soft, and this may indicate that this is where the buttocks are. Then when you come to the symphysis region, you are going to use your thumb and your index finger, press here and feel for the fetal head. So you are going to say, I can feel for the fetal head and it is ballotable. Therefore, the baby is in left occipital anterior. So left occipital anterior, meaning the baby's back is on the left side, the occiput is outward, you're able to feel it, and the buttocks are folding each other like that. If the baby is on this side, on the right side, you're going to say the baby is on right occipital anterior. So once you do that, then you're going to feel for the fetal heart rate. So you just place the fetoscope a bit to the left of the umbilicus of the mother, and as you listen for the fetal heart rate, your nostrils should face the mother's vulva and get the smell that is coming out from there as you count the fetal heart rate. And you're going to say, okay, the fetal heart rate is regular. The reason why you face the mother's vulva is because if there's an infection, you'll get that fishy smell and you need to treat that particular infection. So that's why you face the mother's vulva. If there's dirt, you are able to get that scent that this mother is not clean, and you need to encourage her on cleanliness, because there's what is termed as neonatal ophthalmia, where the baby tends to get this particular infection affecting the eyes, especially during delivery. That's why your nostrils needs to pay attention to the vulva so that you get the scent if there is any infection or any abnormality. But on the fetoscope, you are just going to say the fetal heart rate is regular or irregular, and this is normal. So regular is normal, irregular it means that there is fetal distress. Then from there, you're going to cover the woman and then give her the findings. So you're going to say, Miss X, I'm done examining your abdomen. If you give the findings, you're going to say, Miss X, I'm done examining your abdomen. So far, there are no abnormalities that we have noted. The fetal heart rate is regular, and this is a singleton fetus, is not a twin pregnancy, and the baby is in left occipital anterior. Apart from that, the baby is lying longitudinal, and this is normal, and apart from that, there are no any other abnormalities that we have noted. I will encourage you to continue coming for subsequent examination or maternal visits so that we can continue examining your abdomen. Apart from that, when you are due for labor, make sure you come back to this facility or any nearest health facility and deliver from there. Thank you so much for allowing me to do the procedure. We'll see you next time. You even sanitize, I'll document and report the findings. So that is about examination of the abdomen of a pregnant woman.